Good morning, everybody. Thank you for being with us. I'm Thurman Barnes, the Assistant Director of the GVRC. Before introducing Dr. Sonali Rajan, I want to remind everyone that if you have questions, please submit them in the comments section and we'll get to them, hopefully if there's time left at the end. The comments section, hopefully your setup is just like mine. It should be on the right-hand side. So anytime during the presentation, please just input your questions. Dr. Sonali Rajan is an associate professor in the Department of Health and Behavior Studies at Teachers College, Columbia University. She also holds a secondary faculty appointment in the Department of Epidemiology at the Mailman School of Public Health. She's currently the Senior Associate Director of the Edmund W. Gordon Institute for Urban and Minority Education, and she's also the inaugural president of the Research Society for Firearm-Related Harms. Dr. Rajan is a school violence prevention researcher studying gun violence, school safety, and adverse childhood experiences. She is co-leading research in these areas funded by the National Institutes of Health and the Centers for Disease Control and Prevention. Her work prioritizes the needs for schools and communities to collectively attend to the well-being of children while keeping them safe, reducing their exposure to violence, and ensuring opportunities for them to thrive. Dr. Rajan, we're excited for your talk. Thank you for being with us. Welcome.
Thank you so much. It's such a pleasure to see all of you and to be here today. And thank you for the invitation. And what a talk to follow. Dr. Ramchan set a high bar, so I hope to follow this. Today. So I am going to be speaking I'm just going to pull up my slides. So I'm going to be speaking today, drawing connections between different aspects of my work to really talk through the impact that gun violence has on children, and in particular, what's happening in schools, and really walking this line between clarifying what the scope of the problem is, which is very vast, but also hopefully ending on a note of hope and optimism with suggestions for evidence-informed solutions. So I'm going to bring all of this together for us today. As you just heard, I am a faculty at Columbia University. My work sits at the intersection of public health and education, and so that sort of informs how I think about this issue. Before I begin, I would be remiss if I did not acknowledge just the extraordinary collaborators and colleagues that I am so lucky to work with on all of this work. It really takes just a huge team of interdisciplinary individuals who are all dedicated to studying this issue. And I have shared, you can see here, just some of the collaborators that are relevant to the work I'm speaking about today, but this by no means captures even everyone. So I just wanted to take a moment to acknowledge that. So in the spirit of being, I guess, hopeful, I love this part of a poem that Amanda Gorman wrote, and I just wanted to share this with us today as a way to start off my talk. So all of us bring light to exciting solutions never tried before, for it is our hope that implores us at our uncompromising core to keep rising up for an earth more than worth fighting for. And I think all of us doing research and practice-based work in this space might resonate with this. So this is a quote that I love to share because I think it really captures how we should be thinking about K-12 schools. And in 1995, Drs. Tyack and Cuban, in one of their very famous works, Tinkering with Utopia, referred to schools as having the possibility to be visionary spaces shaped by the experiences of children. And unfortunately, more than 25 years later, and this is alongside the rise of a multi-billion-dollar, billion with a B, school security industry, it really is the persistence of intentional gun violence that overwhelmingly shapes many aspects of a school. That includes its safety policies, disciplinary strategies, physical layout, and budget, to name a few things. And I firmly believe, like many of you, that we can do better. And so this is how I want to begin our conversation today. I share this slide just to give a sense, and I'm going to talk through aspects of this. But this is all, a lot of this here you see is work that my colleagues and I have been doing and really trying to reshape the public discourse on the issue of exposure to gun violence during childhood, and in particular, how we think about responses to gun violence in school. So I'll come back to this during my talk today, but just a little bit of a frame. So let's just dive in right here. As I mentioned, my work really sits at the intersection of public health and education. And so with my public health hat on, I do a lot of work in the area of adverse childhood experiences. And most scientific literature, and we call them ACEs for short, but most scientific literature conceptualizes ACEs as stressful or traumatic events that impact the healthy development of kids through adolescence and well into adulthood. And ACEs are highly, highly prevalent here in the US. They persist as a public health challenge. About 2/3 of adults in the US report experiencing at least one ACE. Research on ACEs, and this is a term that emerged in the late 90s, but it is typically focused on issues like child maltreatment, sexual abuse, household mental illness, family members who have been incarcerated. So really traumatic events that occur during childhood that disrupt a child's sense of safety and stability. Um, Now, ACEs are now understood to include a much wider range of events, including experience with the juvenile justice system, other forms of parental absence. It's also worth noting that many people report experiencing multiple ACEs. I just want to talk through this briefly, and then I want to draw a connection between to the gun violence work in particular. So I love this pyramid here. This is from the CDC. I think it does a really nice job of articulating what not only what an ACE is, but its short and long-term impact. So the understanding is that one of the reason we want to prevent and also intervene immediately in the aftermath of an ACE or multiple ACEs, should they occur, is because they can and do have very significant short and long-term implications for children's health, development, and well-being. So as I mentioned, ACEs can impact kids all the way through adulthood, and this is only if we don't intervene and respond. So let me just want to talk very briefly about this mechanism. So when ACEs occur, and again, as I mentioned, there's lots of different kinds of ACEs that do exist, but if they occur, what then happens is an ACE actually contributes to disrupted neurodevelopment in kids. And that then leads to social, emotional, and cognitive impairment, which then places kids at much higher risk for adopting all sorts of high risk behaviors. That then leads to disease, disability, social problems, and often early and premature death. So, the reason we care so deeply about both preventing ACEs from occurring in the first place and also then responding immediately in the aftermath should one occur is because we see the long-term implications of ACEs. And this is really important for a few different reasons. And I'm going to talk about this in just a moment. I'm going back to this slide. Actually, I'll keep going. Here we go. My students will laugh if they're watching because I tend to do this. I'll make slides and then go back and forth. Now, unsurprisingly, and like many public health issues here in the United States, and this is just something that we are and continuing to wrestle with in all sorts of ways, but we see stark racial inequities when it comes to ACEs. So recent data reporting from Child Trends has really underscored several key findings. First is that 45% of all kids in the US have experienced at least one ACE. Across the nation, 1 in 10 kids has experienced 3 or more ACEs. And really interestingly, research has shown that there is a cumulative negative impact. So the more ACEs a child experiences, the more we see, if we go back to our pyramid here, the more we see some real movement, unfortunately, through this pyramid. And we want to minimize that movement as much as possible. And nationally, nearly 2/3 of Black non-Hispanic children and 51% of Hispanic children have experienced at least one ACE, compared with 40% of their white peers. I'll also note, and this is, I don't think surprising to anyone here today, but the number of ACEs has only increased since the onset of the COVID-19 pandemic. I'll give a couple of examples. First is nearly 300,000 children in the US alone have lost a parent or caregiver to COVID, which in and of itself, parental loss is very much an ACE. Gun violence very much increased during COVID. I'll talk about that in just a moment. Um, and then other types of ACEs, job and economic instability, other types of uh, uh, challenges at home, child maltreatment and domestic violence, all of these things have increased since the onset of COVID. So we are seeing a public health issue that is really significant in its short and long-term impact that has only grown over the past few years. So a lot of my work is really saying, how do we think through the prevention of ACEs and the intervention and response to ACEs because it is so prevalent. Some of the work, and I'll talk about this in a moment, some of the work that my colleagues and I did required conducting a very comprehensive systematic review on ACEs. And one of my wonderful doctoral students who worked very closely with us on that work, as we were doing this work, she and I were emailing, and she said, I cannot believe how every possible poor health outcome you could imagine is in some way, shape, or form tied back to having experienced at least one ACE: substance use, mental illness, cancer, ADHD, all sorts of health issues that you could possibly think of have often a connection back to ACEs. So I really can't underscore enough this area as one that requires a great deal of attention and care, and also one that requires us to really reckon with the systemic factors that have placed subgroups of children at even higher risk for these short and long-term outcomes. Now, this ties to work that I have done, and I'm going to again sort of toggle between this slide, next couple of slides here. So research that my colleagues and I conducted in 2019 really quantified and made the case for exposure to gun violence, specifically during childhood, to be quantified as an ACE. And up until that point, ACEs included a set of experiences, as I was describing before: child maltreatment, housing instability, parental incarceration, parental loss, but had never actively and explicitly talked about exposure to gun violence during childhood as an adverse childhood experience. And so this 2019 work that my colleagues and I conducted utilized a very comprehensive systematic review to make that case, to say, here are all the connections and the comparisons we can draw between experience to gun violence specifically during childhood in all its forms, and that includes, yes, being shot directly with a firearm, but also other types of exposure to gun violence that children experience: witnessing firearm violence, surviving a shooting, hearing gunshots on a regular basis, having a very close friend or parent or sibling carrying a gun. So there's a set of gun violence experiences that many, many children go through and experience that our work really made a case to say, hey, yeah, we are looking at ACEs. It's really important we talk about ACEs, and it's also important that we expand our definition of ACEs to actually include gun violence exposure during childhood, because it needs to be something that not only are we then responding to, not only are we seeking to prevent, but also, given its ubiquity, that we have resources in place to actually intervene in the aftermath. Now, again, I keep referring to this pyramid, but I think it's important to note that something that I think is just so remarkable about ACEs, but also about working with children, is that while ACEs do contribute to disrupted neurodevelopment and can lead to all of these poor short and long-term health outcomes, what the research has also very clearly shown, and this is, I just think, such a remarkable thing, that when and if we intervene in the aftermath of an ACE, we not only can we if we intervene immediately in the aftermath of an ACE, so that means ensuring kids have access to grief therapy, family counseling, but really making sure that we are actively supporting children in the aftermath of these exposures, we can actively mitigate those long-term harms, even the short-term harms. So the sort of amazing thing about working with children is that as much as we are placing them at risk, so many millions of them right now, for experiencing ACEs of different kinds, and in particular gun violence, we can intervene in the aftermath. So part of our impetus to do this research and to really make this very clear case for gun violence exposure during childhood as an ACE was not only to say, hey, this is an area we need to be talking about, but to then be able to galvanize resources under the ACE umbrella so we can better support children. I think I just wanted to provide that context, and hopefully that makes some sense. Now, drawing on that work, last year, some colleagues at Boston University and this is work that was led by Dr. John Jay and his colleagues, and I was, again, very privileged to be a part of this paper. But what we did is we used data from the Gun Violence Archive to quantify racial disparities in childhood exposure to neighborhood firearm violence. And a lot of this work, and we looked at data before and after the onset of the COVID-19 pandemic. And really in this work, this work was to say, all right, let's see what's going on here, right? How many kids are being exposed to at least one firearm fatality in their neighborhoods, right? That would be an ACE. And how are we seeing differences racially in those set of experiences, or are we? And how has this changed since the onset of COVID? And this paper was really devastating, I think, to see the numbers that emerged from this. I think when we first looked at this, the data, it really took my breath away, in that I was convinced we had made a mistake, I think, in the analyses, because the numbers are just that stark. But just to give us a sense of the level of exposure, we have millions of kids, approximately 9 million kids pre-COVID, and about 11 million kids per year since COVID, who are being exposed to at least one firearm fatality in their home neighborhood. Which is just such a huge number. I mean, millions and millions of kids. And in this work, we also found that Black children specifically are disproportionately exposed to this kind of violence, nearly 4.5 times more likely than their white peers. We also found that this exposure to gun violence disproportionately impacts other children of color, Native Americans, Asian Pacific Islander children, Hispanic, multiracial children. And these disparities that we documented only increased following the onset of COVID-19. None of this surprising per se, but I think the level of exposure, the degree to which children are being exposed to gun violence in their neighborhoods, was just really concerning. So we have the scope of the issue here is just something that we need to really reckon with. I also want to take a moment to highlight additional work that my colleagues and I did last year. So this is work that was led by Dr. Lucy Grummet, who's at the University of Sydney in Australia, and her colleagues and some of our colleagues here at Columbia as well. Now, in this work, we explored the clustering of different exposures to childhood adversities, and examined the association specifically with mental health. And in this work, we used data from the National Survey on Children's Exposure to Violence. We had a sample of nearly 2,000 kids, which in this work really underscored that neighborhood violence, which very similarly to what we saw in this paper here, but neighborhood violence ought to be used as a marker of ACE exposure. And that neighborhood violence is a risk factor, unsurprisingly, for poor mental health. And that also there is clustering among other ACEs and this kind of violence exposure. So I share this paper here and sort of giving a brief overview of these findings to really underscore that children are being exposed to violence in their neighborhoods in ways that are just really significant, and that the exposure to that kind of violence, particularly firearm violence, is an ACE, is something that co-occurs with a lot of other poor health issues, and so very much needs to be something that we do everything in our power to prevent the onset of, and then subsequently, should this kind of exposure happen, that we're actively intervening on. I think something that is very challenging, and again, this isn't surprising, but even pre-COVID, and even on other ACEs, which we have known about for years, the communities and kids who often need the services most in the aftermath of exposure to ACEs because they're disproportionately exposed are the least likely to get access to those kinds of services. So again, we have a lot of work to do in terms of really bringing these pieces together. Now, I'm gonna, as I was saying, gun violence very much is an adverse childhood experience, and it's also a persistent public health issue in the US. Um, as you heard a little bit earlier, and you'll hear, I know, later today in talks, gun violence is a crisis. 100,000 Americans are injured with a firearm every single year, with over 17,000 of those individuals being children. Gun violence, it's, as we know now, the leading cause of death among children in the US, recently surpassing motor vehicle deaths just in the past couple of years. About 40,000. I think that number I have here is low. It's more than 45,000 now individuals who die as a result of their firearm related injuries. And as you've been hearing me underscore, these statistics don't even begin to reflect the broader spectrum of gun violence experiences and exposure, witnessing gunfire, hearing gunshots, losing a friend or a family member to firearm related injuries or death. These statistics that I'm already sharing here don't even begin to reflect this broader spectrum of experiences. So part of my work that my colleagues and I are doing in, I would call this evidence-informed advocacy, is really to speak very honestly and clearly and transparently about the scope of the problem. Now, as you heard, and as I was saying at the beginning, most of my research really focuses not necessarily on what's happening to kids outside of the school day, although it's very related, but really looking at what's happening to school kids during the school day. And I'll talk a little bit in a couple slides about a framework that I use to inform my work. But unsurprisingly, and just as we see gun violence persisting in our communities and disproportionately impacting children in these ways, we also see gun violence persisting in schools. Now, since 2015, there have been, and this is based on research that I am co-leading with Dr. Charlie Brandis, also here at Columbia, and using data from the K-12 school shooting database and other data sources. But we have estimated so far that there have been an estimated 290 intentional shootings in K-12 schools across the nation since 2015. And I do want to note that in my work, I am really focused on this kind of intentional violence in schools. So it's not to say that other forms of violence, as you just heard, suicide or unintentional firearm injuries or other types of violence are not important. They absolutely are. But for the purposes of a lot of the work that I have been doing, I'm really focused and interested in what is happening in the context of intentional firearm violence in schools. Recent data from the Washington Post, and this is work that John Woodrow Cox at the Washington Post and his colleagues have been collecting now, thankfully, for quite a long time, but they have approximated that hundreds of thousands of children have been exposed to gun violence just in K-12, just in their schools, not even considering what's happening outside of their schools, but just in their schools since the Columbine High School shooting in 1999. I think every time I go to John's website, I think that number goes up. I just looked at it yesterday. It's about 352,000 children have been exposed. I'm dating myself here, but I'll just share this. I was in high school when the Columbine High School shooting happened. And I remember, and I was just sharing this with my students the other day, but I remember, as many of you probably did, it was earth shattering at the time. I remember feeling it was so shocking, that news, and surely we would the reasonable response at the time would be to do everything we could to prevent something like that from ever happening again. And if you had said to me, to 10th grade Sonali, this would be not only an issue that we aren't actively preventing, but has only gotten worse, I think I would have been shocked. I'm still taken aback by it. So I think this is something that just really sits with me. And as I've been saying, direct and indirect forms of gun violence exposure can and do have serious implications for the health and well-being of kids. And this is based on work that my colleagues and I have published, along with the work of several others. Now, you know, okay, well, let me give a little context first. So first of all, in the United States, we have it's about 98,000 K through 12 public schools that are nationally serving an estimated 51 million children. And, understandably, I'm also a mom. I have a second grader. So, from a parent perspective, I understand what I'm about to say here, which is that the current approach to responding to the anticipation of this type of violence in schools is one of reaction. And I get it, right? When we see the news, we see the, Uvalde and Parkland, but also hear about the many, many shootings that don't make the national news. It makes sense that we want to respond to this type of aggressive violence with responses that are equally aggressive. I think that makes a lot of sense to me. The challenge is that our current approach to preventing gun violence in schools almost exclusively centers reactive strategies that are essentially in place to respond to acts of gun violence in the moment of. And the challenge, unfortunately, is that reliance on these reactive strategies alone are clearly not sufficient because the problem is only getting worse. It has only continued to increase. So clearly, we are not doing something right, and we need to step back and reevaluate this. So responses to the ongoing school gun violence crisis really need to be more strategic. They need to be more multifaceted in nature. They need to be driven by the best quality science. And they need to also address the upstream causes of gun violence well before a possible shooting is a credible threat to a school community. So, this is the part of the talk where I like to shift from talking about sort of walking. I was saying this to one of my good friends yesterday, that walking this line of despair and hope. I think this problem of gun violence, particularly as it impacts children, can feel very it's hard, right? It's so hard. It can be hard to really wrap our head around the scope of it and how it is an increasing problem. But I am hoping that in the next 20 minutes or so, 25 minutes, I can walk us through how we might move forward and what some of those solutions to the persistence of gun violence can and should look like. And so, what I'm really going to present here is a school gun violence prevention framework. And this is work that I co-authored a few months ago with my colleagues here at Columbia, Paul Reaping, Zara Ladhani, Lalita Vasudevan, and Charlie Brannis. And in it, we put together a very comprehensive framework that really shifts the emphasis away from a primary reliance on strategies intended to react to school shootings in the moment of a violent act, and instead broadens the spectrum of what currently constitutes school gun violence prevention. And really, in doing so, reimagines the prevention of school gun violence as an opportunity to meaningfully invest in schools and in its surrounding communities, and by extension, our kids. So I'm going to talk through this. And yes, please continue to put questions in the chat. I look forward to answering them afterwards. Okay. Now, many of you, I'm sure in the audience, have seen this or maybe refer to this in your work. This model right here, this is the whole school, whole community, whole child model. Say that 10 times fast. This is work published by Llewellyn and colleagues in 2015. I think I referenced this and utilize this framework in pretty much everything I write and do. But this is one of the very few conceptual frameworks that exist that actively are drawing the connections between health and learning, and breaking down some of the silos we tend to see where we are where we tend to focus on health as separate from education, when in fact the two are very clearly related. What you'll see in the green center here is the goal for every kid. We want kids to be healthy, safe, engaged, supported, and challenged. And that should be a given for every child, not just kids in well-resourced communities and schools, but every one of those 51 million kids I referenced earlier should have this kind of experience in schools. And what this framework underscores is that to get there, we need a coordinated set of policies and processes and practices. And this involves investing in our communities, family engagement, attending to employee wellness issues, and not just burnout and how are we addressing some of the basic day to day, but really attending to the needs of teachers and school staff. Thinking about the school and the social and emotional climate of a school, thinking about its physical environment. Do we have access to counseling, psychological and social services, other critical health services? And then what this model also recognizes, and I think this is really important, is that what happens in the surrounding community, in the community surrounding our schools, and again, this makes a lot of sense, I think, intuitively, but that then informs what happens in the community, what happens in the school, and by extension, what happens, the experience that our kids have. And all of this, I feel like I say this, and many of us probably work with kids or have kids of our own, and we all know, right? Like, we all know what we need or what our kids need to go to school and take tests and function. You need to sleep well and have a good breakfast. And I could tell you the 7 things my 7-year-old needs every morning to be able to go to school and be an engaged and productive member of his class and school community. And so by extension, we all need that. And these are, so the way in which, what I love about this framework is that it acknowledges and recognizes that children are full individuals with needs that need to be attended to during the school day and outside of the school day as well. So I wanted to spend a little time on this because this does inform this framework I want to share with all of you. Now, the elephant in the room, and we've heard about this, and I know you'll hear about this more later today, but yeah, to quote one of my very good colleagues and friends, we can't have gun violence without a gun. And so we need to fully and head-on address access to firearms as an important component of a school gun violence prevention framework. Now, right now, there are over 400 million firearms in circulation in the US. It's a figure that, as many of us know, increased considerably during the COVID-19 pandemic. There's a graph, I remember this vividly, that the New York Times published in April of 2020 documenting this increase in firearm sales, and it's really stark. I mean, the jump in firearm sales month to month from pre-COVID, post-COVID just went up in such a considerable way. So we have to figure out, how do we coexist safely with these 400 million firearms? And there's a very clear need for the coordinated implementation of policies that are known to reduce access to firearms, and by extension, the likelihood of gun violence in K-12 schools. I do want to say that that research my colleagues and I conducted last year, and this was work led by Paul Reaping, and that we published in the Journal of School Violence. In that work, we very clearly show that states with more restrictive gun laws are significantly less likely to have and experience active school shootings, specifically in K-12 schools. And we know that relationship exists for other types of gun violence as well. But what do we mean by this? So there's, and I think it's really important, and I should say, I think it's really important to underscore that there's no one particular solution. There's no one single policy that will fix the gun violence issue in our country. And we have to, I cannot emphasize this enough, that it's not one law or one program, but it is a coordinated set of policies and practices, just like we see for other public health issues that we have been successful in talking about, reducing, drinking and driving, death and injury from drinking and driving is a nice, I think, analogy. But we really need a coordinated set of solutions. Okay, so from a policy perspective and from an access to firearm piece, this means large capacity magazine bans, right? This includes red flag laws, which are also known as extreme risk laws, implementing permit requirements to purchase firearms, ensuring that all states raise the minimum age to purchase semi-automatic firearms to 21 years of age. This would have a particular implication for school shootings, where often perpetrators are under the age of 21. And then, and very importantly, and we heard some of this before, promoting safe safe firearm storage practices. So that is storing guns in homes locked and unloaded and separately from ammunition, and working closely with families to normalize these safe storage practices. So thinking about access to firearms collectively as one component of a broad prevention strategy has to be part and parcel of our collective conversation. But thankfully and encouragingly, and I know there's a lot, it's hard when the public discourse, I think, gets very mired in the nuances of this and doesn't necessarily see beyond potential legislative solutions. So hopefully what I'm hoping to offer here today are other solutions that go hand in hand with this that would be very helpful for this. Um, so I'm shamelessly using, these are pictures of my little one and his friends in this talk. Um, okay, so I want to start, if we think about that whole school, whole community, whole child model that I referenced, we saw community level change. We saw how the community impacts the school, impacts the kid. So I want to start, we saw the access to firearm piece, and that is critical. We also need to now think about what's happening at the community level. This is, I'm going to go ahead and say, this is not work that I have done. This is research that my colleagues have done and that I have read and synthesized in this paper that I'm referring to here along with others. But there is a significant body of research that has demonstrated the enormous value of investing in community structures and resources as ways in which to effectively reduce gun violence while also improving a myriad of other health outcomes. And while this body of research has largely focused on community level gun violence, there are important connections to school gun violence prevention as well. And so attention to these connections is particularly salient, right? Because it's well established that, first of all, experiences with violence beget more violence. And as has been talked about, in the context of other social phenomena, the boundaries between a school and a neighborhood that surround a school we consider them porous, right? And so, in other words, violence is not always geographically isolated to a school building or to its surrounding community. And as I was just saying, kids are not robots, right? What they experience outside of school impacts their experience during the school day. How could it not? So it's really important that we um, understand and recognize that what a child experiences in their community naturally influences their school experience. And so a comprehensive school gun violence prevention framework has to consider the neighborhoods within which a given school is situated and also the experiences that kids are having outside of school. Okay, so what do some of these solutions look like? So again, we did a very comprehensive systematic review of the literature. The reference list on this paper is like in the hundreds, or it's like, I don't know, there's probably like 120, I think, articles we ended up citing. But here are some things that really matter. Investments in green space. Okay, these are, and by the way, we could probably spend an hour on each one of these. I'm just going to give a high level overview today, but happy to answer questions at the end. Investments in green space, ensuring access to affordable housing, improving street lighting, ensuring equitable access to early childhood education, specifically during a child's preschool years, and that could include providing caregiver support and access to needed health services, increasing access to community-based programming that engages teens later in adolescence, particularly programs that incorporate meaningful job and educational training, investing in public libraries. I understand that this may not feel like gun violence prevention, but what this research has shown on each of these components here, these place-based interventions that really are looking to our communities and saying, let's invest in these basic and needed infrastructures in our communities. Let's break those cycles of disenfranchisement. I think what is fascinating is how this body of research has shown direct connections between these kinds of investments and reductions in community gun violence. So if we go back to the beginning of my talk where I'm talking about the millions of kids exposed to violence in their communities on their way to and from school, how do we disrupt those cycles? How do we ensure that the neighborhoods in which our children are living and playing are fundamentally safe? And that has to be part and parcel of what we consider a comprehensive gun violence prevention framework. That has to be part of the conversation. So in our framework, we talk through this as an important component, being mindful of time. So I'm going to kind of move forward. Now, at the same time, there's also an understandably, considerable research on the role of the school environment, of course, itself on and its relationship to school violence. And I think we can and should draw on the efforts that we know effectively prevent other forms of school violence to help us understand what are some of those best practices and the best ways to address school gun violence in particular. So again, we talked about access to firearms, we talk about what's happening in communities outside of the school. So let's talk about what's going on inside the school. So we know, and in our work, we really suggest that primary prevention efforts, so efforts that really get at the root causes of violence. So I'm talking about efforts and investments well before a school gun violence, well before a gun violence incident in a school is even a credible threat. So really thinking about upstream causes, really true public health here. But yeah, implementing universal school-based violence prevention programming where we're focusing on pro-social skill development. Using restorative justice oriented conflict resolution practices coupled with removing some of the more punitive disciplinary policies that currently exist. So I'm going to give I spoke about this the other day. I'm going to give just a quick example here. So one of the currently, and I should double check this, but I'm almost positive, under the Elementary, Secondary, and School Act in the United States right now, in every state, in every public school, if a child brings a firearm to school, okay, they don't use it, but they bring a firearm to school, they are, without no questions asked, this is what we call a zero tolerance policy. That child has to be expelled via this policy. They have to be expelled from their school for at least 1 year. No questions asked. That is the consequence. Now, obviously, a child bringing a firearm to school is a very, very serious thing that has to be addressed and attended to. But we need to be asking why. Why did they bring that gun to school? I can tell you that research that I conducted with Kelly Ruggles here at NYU several years ago, and this also is supported by other research, has shown that kids who are reporting carrying a gun recently, whether to school or in their communities, are reporting that because they've either had previous experiences with violence, they feel unsafe walking to and from school, and their perceived sense of safety is that their community and or school spaces are not safe. So if we are placing children at risk for experiencing this kind of violence, and they are then carrying a gun to potentially keep themselves safe because they don't feel safe, and our response is to then expel them from school with no attention to what's happening in their school or community, we've missed the boat, right, on an opportunity to really intervene and to get at the root cause of this kind of violence. So so this is something that I think it's very complex how schools engage in discipline, what those policies look like, but there's really, just again, really rigorous research that has talked through the value of reimagining, right? Being creative and really thinking instead about what response to conflict and potential threats can and should look like. I also want to highlight the value of evidence-informed bystander interventions. And so there's lots of really great, just wonderful research, again, conducted by others that has focused on the role of bystanders in influencing both bullying and other aggressive behaviors during the school day. And we can draw on that work to better understand risks for violence perpetration as well. But essentially, work has described how even passive bystander behavior, for example, or essentially that means a lack of intervention in the moment, can inadvertently enable contentious interactions between peers, and then that can escalate into more serious forms of violence. But what I think is really encouraging is that research has highlighted the connections between a positive bystander, so someone who discourages the contentious interaction and or helps to redirect the situation, a positive school climate, and decreases in the prevalence of more aggressive behaviors at school. So that kind of work, which can be embedded, often draws on good social emotional learning practices. All of these are examples of positive changes to the school environment that we should consider as part of a school violence prevention framework. Now, this right here, I pulled this the other day. These are headlines from the past few weeks. I mean, I didn't even really have to go back that far to find these. But right now, and as I mentioned earlier, I understand, right, as many of us do, the desire, the need for schools and parents collectively to want to do something because you see these shootings occurring in school and it is very unnerving. Of course it is. How could it not be? So right now, we are seeing here in the US active shooter drills, clear backpack policies. We're seeing school districts arming their teachers with firearms. We're seeing high school students being trained to stop the bleed and learning how to tie tourniquets in the case of a shooting. This is one, and the challenge here, right? The challenge here is that there's very little, if any, evidence driving the effectiveness of any of these strategies here, right? There's no clear effect, there's no clear data guiding this. And yet we're implementing these strategies widely. So what do we do instead? Okay, or what should we be doing? So there's significant evidence gaps, and many of the strategies that I just described have very limited data guiding their effectiveness. Metal detectors, armed teachers, bulletproof backpacks, all of these are strategies that at the moment, there's very either inconclusive evidence or no evidence that they would be effective at either deterring an intentional shooting from happening in a school, nor would they actually reduce the lethality of a shooting should one occur. Now, Charlie Brandis and I here at Columbia, we are currently running an NICHD funded study where we are actually, it's a case control study, and we are actually evaluating this across a sample of about 700 schools across the nation to evaluate whether or not these types of school safety strategies at the school level, are they either alone or in combination, are they effective at deterring this kind of violence in schools? And so maybe if you call me back in a year and a half or so, we'll have lots of data and hopefully some preliminary results to really show more conclusively whether these strategies are actually effective. They also, I should add, are expensive. So there was a report that came out in 2013, I believe, that highlighted that if we armed even one teacher in every school, that would eat up 30% of the federal education budget. So, like, when we think about, we need to be having these conversations across silos, right? The public health and education folks, we need to be really saying, all right, what does that budget look like? Is this the best use of our funds? It seems potentially misguided, right, to implement an armed teacher policy when we don't know that it works, that it's expensive, and that it might contribute to other unintended harms. So the school safety world right now is very focused on these kinds of things. As I was saying earlier, what do we do in the moment of a violent act? Now, encouragingly, there is some really wonderful research on a couple of aspects of school safety and security that do give some guidance and light as to what we could be doing. So as I was saying before, we want to think about firearm access. We want to think about investments at the community level. We want to think about investments at the school level and really think and focus our emphasis on those primary prevention efforts. But it is also very reasonable to say that we should have a good emergency response or threat assessment plan. And here is where research by Jacqueline Schildkraut, who I believe you're going to hear from later today, and Amanda Nickerson, and then work by Dewey Cornell and his colleagues have really given us some insight as to what can and does work. So the lockdown drill piece, I think, is really important to talk about. First of all, lockdown drills are widely implemented. And I think I was looking at a number the other day. I think it's about 95% of schools across the US are implementing some form of a lockdown drill. And the emphasis there is some form. And I want to talk about that. Now, what Dr. Schildkraut and her colleagues have shown is that when you implement a lockdown drill utilizing best practices, and I'll talk about briefly what those are, and this is based on her work in just a moment. When you do that, implementing lockdown drills can be a very effective emergency response tool. They can help students and school staff alike feel more prepared for this kind of emergency. And this is good, right? Again, when we think about a broader framework, this cannot be the only solution, but should it be part of a broader set of solutions? Absolutely. The challenge is there's the way drills are implemented in areas in schools really vary. As some of us have seen, sometimes active shooter drills can be implemented. Schools are using realistic props or surprising the students and staff in the process and whatnot, and that's not okay. But what Dr. Schildkraut and her colleagues have shown is that when these drills are implemented in a developmentally appropriate manner, when they follow the guidelines put forth by the National Association for School Psychologists, when they are planned drills, when they are overseen by an interdisciplinary team of school staff who have been trained to implement them, when they incorporate time before and after for teachers to process with their kids, then lockdown drills can be part of an effective strategy. And I think that's really important to note here. I also want to talk very briefly about behavioral threat assessment, which is a really well-researched, there's extensive evidence talking about behavioral threat assessment, again, as another important tool. And essentially what happens in the context of behavioral threat assessment is that a student might make a potential threat, and again, a team of trained school professionals, often comprised of maybe the guidance counselor, a teacher, maybe a social worker, but a team of school professionals, they intervene on that threat. They meet with the student. They talk to those students' caregivers. They find out what's going on at home. So it's a more individualized response to a potential threat, but it has shown to be potentially very effective at reducing that threat from evolving from a verbal threat, to something far more serious. So I think that's really important to underscore. I'm going to spend the next couple slides, and then I'm going to wrap up in the next few minutes talking through just mental health and early interventions. So understandably, the last kind of component of our framework, we talked about, again, access to firearms, community, school level environments, what's going on as we respond to individual kids. And then, we have to expand the capacity of child mental health services in schools. We have a school psychologist shortage right now here in the US, and we need to address that. We need to train teachers and parents and even siblings so that they are collectively able to provide support to students who might be at particular risk. We should connect schools directly with local community organizations who are already providing these needed services, so we're optimizing these processes. And we need to increase the level of funding, right? It could be via state and local grants, but we need to increase the level of funding, even being made available directly to school districts. All of this is part and parcel of a needed collective response. There's also school-wide interventions, and I've included a few here. We refer to these as sort of psychological first aid, but interventions that are feasible to implement and effective at specifically reducing post-traumatic stress disorder should a shooting or something to that, or that type of event occur in a school. And this is really important in the context of school gun violence, because we know PTSD harms often propagate more violence if they're not effectively treated. So employing some of these, again, very well-researched, established programs, and ensuring that staff at least are trained to implement them should a shooting occur is really critical. If we go way back to my ACE pyramid there, we want to intervene very early and effectively at the onset of this kind of violence. And then lastly, of course, trauma-informed schools. What this really means is we need to help schools and support them so that they are collectively able to mitigate any additional individual harms that might be associated with school gun violence exposure or gun violence elsewhere. Again, revising those school disciplinary policies to be less punitive, working closely with families to meet the needs of students, knowing what the symptoms of traumatic stress look like, and assessing them, and then intervening and collaborating with community resources to really ensure that kids are supported outside of school hours. And all of this, of course, assumes that we're also attending to the needs of teachers and school staff who have also been placed at high risk for a lot of this potential trauma. So there's another layer to this that also needs to be attended to. If I just to briefly summarize, we need this more expansive and evidence-informed set of strategies to prevent intentional school shootings in kids. We really, kids deserve better. We need to enhance these basic neighborhoods and school structures. We need to invest in affordable housing and public libraries. We need to do this alongside stricter gun laws that are very reasonable and would allow us to coexist safely with the millions of firearms in circulation. We need evidence-informed school safety efforts, and we need meaningful investments in early interventions and mental health services. Really, what this requires is a reframe of our discourse around school gun violence to not be simply about reaction, but really to be about meaningful prevention. So like I said, I had so many references, but just highlighting a few more here. Thank you so much for the opportunity to be here and to speak with you today. I put my contact information here. I'm happy to take questions. So thanks.
Yeah, I was waiting for it to move to slide over. Thank you very much for being here. Very interesting presentation. Seemed like your conversation around ACEs has gotten a lot of hits. So I'll begin because we don't have much time, and I'll start with the questions that came in versus the ones that I prepared. So the first question, Eric Vidal, I'm sorry if I'm butchering your name. It's a two-part question, I believe. What approximate percentage of ACEs are gun violence related?
It's a really good question. I'm going to tell you, this is related to, I think, a conversation we were having after the last presentation. We are not widely systematically right now collecting gun violence as an ACE data. This is something I hope I would really like to change. There's obviously various groups, Gun Violence Archive and the K-12 school shooting database, and other various organizations who are collecting experiences with gun violence in and outside of school. And I know I referenced them here, but we are not systematically collecting this information on a national level. So I don't know.
I found this on the web for this information. Check it out.
I apologize.
No. That's okay. No. I was like, oh, there's another voice. But I can tell you based on the numbers that they are prevalent. Now, the second question there is exposure to news. It's not. It doesn't fall under the way we operationalize ACEs, which is a specific experience that really disrupts a child's daily sense of stability and safety. So right now, that news exposure is not. Now, is news exposure to gun violence something that needs to be done carefully or thoughtfully or not at all, and develop at an age that feels appropriate? Yes, that is absolutely true. And so anyway, hopefully, I realize that's not an answer to your question, but you know what, this is a good call to our leading public health agencies to say, hey, we need to collect these data because it matters and it is prevalent and it's an issue we need to pay attention to.
All right, I'm trying to do my due diligence here. Next, Karen Cantor asks, what do you think about the firearm curriculums that some schools use?
So, Karen, great question. I'm assuming you're referring to, there's a couple that are coming to mind. One is programs that teach kids how to use guns safely and securely. There are some safe storage programs that school nurses are helping to spearhead and implement, which I think are wonderful because that's a great connection between schools and families. There is some programming around teaching very young kids what to do if they see a firearm, right? If they see a firearm that's, not locked and stored away, what should they do? So my very brief answer to that question, without knowing the evidence base around their effectiveness on specific outcomes, is to say, all of this is good, right? Normalizing safe gun storage practices is good. Normalizing that guns are not something for children to touch or play with is good. So I think any effort that is really allowing us to, again, coexist safely with firearms, I think is really important. Great question.
I have a question from a Laura Robinson.
Mhm.
And so it's a little long, but I'll start here.
Yeah.
Children are often much more aware of the salient issues than adults even realize. Could expectation of possible gun violence on, the expectation of possible gun violence on children act as an ACE?
So great question. And again, I'm going to say, invite me back in a year when I have some data. So I mentioned one study that Charlie Brandis and I are co-leading on school safety strategies. We are also currently co-leading a second study funded by the CDC where we are collecting data directly from kids in schools to try to get at this question, which is, okay, what is the mental health burden that is being carried by kids who are in school that have experienced a shooting? But if we look at kids in schools who have not experienced a shooting, but maybe are experiencing these drills or other, types of safety strategies that are in place, exactly as you say, to respond to the anticipation of this kind of gun violence, what does that impact look like? So we don't know. There's a lot of things we don't fully know. My hope is, I think the existing research, and I think this is very encouraging, could allow us to step back and say the presence of these positive school climate indicators I was talking about and fostering positive childhood experiences, which is sort of the opposite of ACEs, could do a lot to actually intervene and mitigate the potential harms we might see. So this is like, again, I love working with kids for a lot of reasons, but this is part of it because there's a lot of potential solutions we can actually implement that would foster their health and their well-being in really great ways. So,
Well, you may have the same or similar response to the second part of the question, but I'll ask it anyway. While lockdown drills are clearly essential at the moment, may these act as an ACE for children as they are likely to be stressful and frightening, especially for younger children?
So again, I'm going to point to the
Yeah.
really excellent work that's been conducted by scholars in this space that have really shown that when lockdown drills follow these best practices, and there are very clear best practices, they should not be particularly frightening. They might be, yes, they might be stressful, but should not be frightening. They should be a part of an emergency preparedness effort. Now, I'm not saying, and listen, like I said, I have a 7-year-old. He has now undergone 6 or 7 lockdown drills in his brief school experience. And yeah, it is unnerving to know that. I think what's helpful is when, and again, the research backs this up. Teachers are processing with the kids before and after. As parents, we talk, talk to the teachers, see what's happening in schools, find out how the drills are being implemented. But when the best practices are working, right now it would not fall under what we consider an ACE, but something to pay attention to, right? Something to make sure the school is doing well. There's a lot of poorly implemented drills that happen, unfortunately, and we want to move away from that. So great question, Laura.
Question by Frank Plunkett. In today's news, a Texas proposal would train fourth graders on tourniquets. Now, on the surface, this seems like a good idea, but is it? Would the training cause undue trauma for the students?
I have a lot of thoughts, maybe not appropriate for a talk right now. Here's what I'll say. I think that, so first of all, I think that there is some research on like the Stop the Bleed program. I think certainly among adults and among adult bystanders, and being a potentially useful tool. And so that seems like maybe a reasonable thing to implement in a workplace setting or something like that. It might be appropriate for school staff to be trained in. I have yet to see any data that kind of training would be appropriate or effective or helpful for children that young. Fourth grade is young. We need to think about, and this is where I think the ACE work is really fascinating, the implications of this kind of exposure on their developing brain. And I think it's really important that we very carefully implement these strategies. So my response is, let's focus on all the other things we know do work. And implement our efforts there before we place this burden on our children.
So this may be our final question. It has a couple of parts, but I think we can take a stab at it. It comes from Joanna Paxton Federico, and I think we just kind of move over those where it's a broad question. But I'll just start there, and if you don't feel like answering that, we'll move on. Can you speak to the interaction of gun violence and police violence as public health crisis, especially among young people of color?
Yes. Okay, very briefly,
Right.
that's its own talk in and of itself. But yeah, the interaction of these different types of violent experiences, recognizing that a child might survive one school shooting only to then experience another. We know that kids who might experience violence in schools may also experience violence at home or in their communities by police. And we know that children of color are placed at disproportionate risk for all of this. So there is an interaction, there is a cumulative effect there, right? Where the more of these experiences are happening, the more likely those kids are to face that sort of movement up that period. And if we're not intervening and we're not also doing what we can to prevent these ACEs in the first place, then we're placing them at higher risk. So I try to think about this as a saying, this is why I love that model, because it's like, okay, let's think about the needs of kids from the policy community on down, because it's not just about these one-off experiences. This level of violence is prevalent enough that we really need to think about its prevention as a whole. So great question. Yeah, I could talk for hours about that.
I think we're at time, maybe a few more seconds. I just want to take the remaining time to thank you for a very thought-provoking presentation. Really enjoyed your talk. Thank you for being with us.
Thank you so much for having me. It's great to see you. Thank you for the great questions, everyone.